the data work you do, the research. What was it that had you take that step from being the scholar and trying to understand the patterns to someone who is taking a public role, whether it's on Twitter or in the news, to try to like get the message out that's broader than your research, just like the public health in general? So tell us like where that started.
Yeah, so that really started on May 13th, which was the date that the CDC director changed the mask policy guidance to say that people who were vaccinated could take off their mask. And I thought that was potentially disastrous from a public health perspective, and I'm really sorry to see that has been the case. I knew at the time that less than 50% of people were vaccinated and that there were enormous disparities in vaccination, and that too was by policy design. The ethicists and ACIP had actually, the Advisory Committee on Vaccine Practices had actually recommended that essential workers be prioritized for vaccinations before people who are 65 and older. And the recommendation to prioritize people who are 65 and older explicitly prioritize white people who are more than twice as likely to be over 65 relative to people who are Black and Hispanic and Native American. Even though we had seen people who were Native American and Black and Hispanic die at much higher rates, especially the essential workers at younger ages. Mary Bassett has a fantastic article in PLOS Medicine about describing the age-specific disparities, and they range from some 3 to 19 times more likely to die within age groups. So I think that's actually an important aspect of COVID analyses that hasn't, and of economic analyses. I think that's an important area for us to move forward in, is explicitly looking for heterogeneity by different subpopulations and acknowledging that structural racism and structural inequities really shape that, but also that our current policies are part of that. Can either make it better, or they can make it worse.
Well, and that's like such an interesting, like bringing your expertise into this, and you had looked at racial disparities, marginalized groups in prior work on very different topics, because as someone like me, when you hear the mask mandate is being lifted nationally, I think it wasn't in, like, as I was watching the discourse, a discussion about that's going to affect different people differently, right? Because the mask is giving protection in certain ways because of who had access to the vaccine, so I think to me, that hearing you talk about that's such a good example of you bringing your past work and understanding that there are deep racial inequities in public health, or, and who access to health, different I don't know. So I love that point, that as soon as you saw that, which was a very national, it's okay to take the masks off, it seems your mind was running to the implications for certain vulnerable groups.
Yeah,
so,
and a lot of the work I've done previously is on trying to understand why there's such enormous racial disparities in HIV among men who have sex with men now. I'm trying to understand how that happened over history. And so at this point in time, 1 in 2 Black men who have sex with men will get HIV in their lifetimes versus 1 in 11 white men who have sex with men. And I think actually with PrEP, that's probably much lower for white men who have sex with men now, but not for Black men who have sex with men, with PrEP being pre-exposure prophylaxis to prevent HIV transmission. And so, I think trying to understand how those disparities came to be, you see a lot of it is the denial that happened at the beginning. And I now think, maybe we should anticipate some of that and explicitly seek to counter it. This is one of the biggest lessons learned from another pandemic. And I think I think it's a time of historical importance for shaping our society going forward. The disease may be here for a long time to come. The ramifications will be here for a long time to come. I knew that from just fantastic reporting from NPR that about how much Hurricane Katrina had exacerbated racial disparities in part because of the policies that, and that they explicitly made Black and Latinx people worse off relative to white people during that recovery, and the same with the Great Recession, right? And so I knew that we needed to take this disaster that was even worse, and that was a dual disaster, really seriously. And I knew we were in trouble with that decision, because I knew it was likely we would need mask policies again sooner or later. I hoped it would be 5 or 10 years in the future, and it was a month later. And I think it's important to, in terms of having humility, like, yes, let's acknowledge the mask data are imperfect, but what I would guess as someone who's read the mask literature is maybe they reduce transmission about 30 or 40%. Let's say it's even just 10%, or let's say it's more and it's 60%. In any context, that is tens of thousands of lives, especially of low income essential worker parents. And for economists, like, in addition to the social and emotional effects on children who have to grow up without their parents, who are already disadvantaged and low income, what does that do to human capital? What does that do to their circumstances in life? What does that do to our society to let that happen and not seek to counter it? So I was concerned, and I started out, I immediately just started communicating what I had been, planning to publish in a manuscript in a few months. I just started communicating it as quickly as I could. Here are the vaccine disparities. I really struggled. I was devastated that we would make such an inequitable decision, but I really tried to keep it positive, and I wrote headlines like "Celebrate essential workers by delivering them vaccines," and and tried to encourage us to do the right thing. And then Delta started to hit, and I just shared the data on hospitalizations every day, on parent and child hospitalizations. Ultimately, parents died at a record rate. Young people died at a record rate during the Delta wave, more than at any prior point in the pandemic. And that was partly because we did not seek to reduce transmission like we had previously. So in 2020, 43 states had mask policies that reduced transmission. During the Delta wave in 2021, 7 states and the District of Columbia had mask policies to reduce transmission. And Delta really concentrated among the people who were most vulnerable. It found people that I found there were quite a lot of people who were unvaccinated. It was like 45% during Delta. And there was this mistaken notion that we needed, put out by one of the people who puts out the most misinformation, this mistaken notion that we needed taking off masks to be an incentive to get vaccinated. And that was based on an incorrect premise that vaccines were perfect or near perfect for reducing transmission, that what we do as individuals matters, and not how we interact with each other in a virus that typically spreads several other people. So policies are important here, and mask policies are important because it takes coordinated action. The externalities are incredible. Not only for spreading the disease, but also when somebody gets sick, keeping the kid out of school, keeping the parent at work, making the family food insufficient. We find most low-income workers do not have paid leave. And when they're home and sick with COVID, they don't have enough food to eat. And what a way to force people to choose between going back to work while they're still sick with COVID, and staying home to recover. And that's if they're lucky and they're not hospitalized. So it's just, it's really hard to watch. So I think I just, so I think it's, I just thought it was important to communicate the evidence about how mask policies work, about how I think people had come to oppose all aspects of public health because the lockdowns were so miserable, and school closures were terrible for everybody. And I too found those terrible from not just from a personal perspective, but from a population health perspective and economic perspective. I know that they were destructive. I know that we don't want to do those. And we did those because we needed to learn about the virus. Like you can see the death rate in New York when they were hit by that first spike was just enormous because we didn't know anything about how to treat it. We thought it was on the mail or our groceries. And now we needed the time to learn about it and learn about how it spread and where. And we have to always keep in mind, like, it spreads in the air, shared air, in crowded indoor spaces. So that's any crowded indoor space, any population. So that is the grocery store, and that is religious institutions, and that is a manufacturing plant, and any workplace that is crowded, a restaurant. That is also schools. The headlines that COVID didn't spread in schools, the people who still continue to say that, that is not correct. And first, like, we know that from the logic. We also can see in the data that that kids who are school age have the most cases of any population, any age group right now in the United States. And COVID is spreading in schools. Now, part of this limitation is you'll hear it from policymakers, oh, well, the data we collect show that it spreads at home if people gather with each other. That is because you have contact tracing ability with our very limited, like, poor contact tracing ability. If your friend came over and they got COVID and they told you, then you know you got it at home. But there's practically no way you're ever going to learn you got it at the grocery store, or that you got it at school. Like from if like they have these protocols where what counts as an exposure for something that's shared in the air, and people are getting it when they don't even share air if they're in hotel rooms that share a hallway, and like you're not going to learn that. And so we just have to keep that in mind. And like, I wish it wasn't true. I wish kids did not have to wear masks. But in our current circumstances, it spreads in the air. The spread is a problem. The spread is a problem because it is a serious disease. We still have more to learn about how severe it is with vaccines, how severe breakthroughs are, how much they wane. We definitely see that surges that are completely uncontrolled disrupt everybody's lives, regardless of whether they're vaccinated. And so the only way we can confront it is to like have a management plan. Right now, we are practically implementing no policy. We're implementing like supposed vaccine only policy, but only 60% of people are vaccinated. So we're certainly not implementing that well. And we never did several of the things that President Biden laid out that he planned to do in his January 2021 plan to help get low-income people vaccinated.
And so
what kind of turn to like, what do we do?
Yeah, no, well, that's what so it's clear, and I think this is abundantly clear to everyone, that if we could go back with what we know now, policies would have been rolled out differently, communication would have been different, we would have prioritized in different ways, maybe not listened to some people as much as we did, but so that's in the past. We know that COVID is still here. It continues to come in the way, like there was Delta and there's Omicron. And my impression is that back at the beginning of the year when the vaccines were coming, there was this hope and optimism. COVID is in the rearview mirror. Like, not that it would go away, but we have the ability to contain it. The summer was supposed to be great, and then we'd be done. And then it'd just be getting back to normal, the cleanup, and that's not what's happened. And I know as an economist and studying the data and what's happening to families, there are disruptions like high inflation. It is so clear, or the labor market disruptions. It's so clear, especially this fall, where you see Delta has its fingerprints all over it. The supply chain disruptions that we've had for 2 years are causing problems, shutting down the global economy, turning it back on. And I have, said more and more, like, once we get the pandemic under control, then these economic problems will subside. But over time, I think people just either want to ignore COVID or like don't see those connections anymore. And it's just like, I don't know how you fix the economic problems until you fix COVID. But looking at what's been happening, like it's not, I'm becoming more pessimistic, but I know like once we stop trying, then we've ceded all control to a virus and to people's individual decisions.